Well, good afternoon, good morning, good evening, depending on what time you're watching this. I'm Brad Clark, Coach Brad with the Action Coach Business Coaching Services, and I've got the distinct privilege to talk with Dr. Eva Mackey, owner of Rockwall's Gym MD. Dr. Eva, how are you?
I'm doing well. Thank you, Brad. Thank you for having me.
It is absolutely my pleasure. It's an opportunity, a great opportunity to talk to you, and we've had some conversations before, Dr. Eva. You've got a very unique and very, I think, probably an area that medicine is going to start to evolve towards in the near future. So why don't you tell us a little bit about your business model?
Okay, so I'm a primary care doctor. I'm a family medicine doctor. So that means I see all patients from cradle to grave for all kinds of different things. And I left a more typical medical practice to open up something called direct primary care, a direct primary care clinic. So I'm still practicing family medicine the same as I did before, but the business model is different. So it's meant to get patients better access to care and better access to their doctor, and to contain the prices. Because I know that insurance is extremely expensive these days. Half the time it doesn't pay for what you need anyway. Patients can't get a hold of their doctor when they need their doctor. They can't just have a phone conversation with their doctor. Every time they have the tiniest little issue, they're always told they have to schedule an appointment, wait hours in the waiting room. It's, the problems for patients in primary care goes on and on. So this model is intended to address some of those issues. So what I do is I don't file insurance for office visits. I don't actually bill the insurance at all. So I have an affordable monthly membership fee that gets my patients unlimited access. So with the monthly membership fee, patients can see me in the office as often as they need to, and they are not billed for it. We can talk on the phone. We can do video telemedicine visits. We can text each other. We can email each other. So the communication is open, and it's a more fluid kind of relationship. So I tell patients, I'm your doctor all the time, not just when you're in my office. And that is true. So then I try to keep other costs under control as well. So tests that are done in the office, such as strep tests, flu tests, urinalysis, EKG, I don't charge for that. That's just included in your membership fee. Blood tests, I have negotiated for greatly reduced rates, and I pass those discounts on to my patients. So for example, a lipid panel is only $5. A CBC, that's a complete blood count, that's $3.50. So I give those highly discounted prices to my patients. And then whatever else you need, I try to find you the best deals possible. So many of my patients are uninsured. This is clearly a great deal for uninsured patients. And then this is good for some insured patients as well. Often insured patients who have an HSA, like a credit card associated with an HSA, they can pay the monthly membership fee with their HSA, and then that gets them access to better care and then discounted prices on things, because oftentimes if you get blood work done and bill your insurance, you end up with a bill later on down the road for a few $100s. Here it's all about price transparency and keeping the prices low.
That is awesome. I really do believe, especially. So I was in the medical industry for quite some time on both the clinical side and the for-profit side, and healthcare being what it is and costs being what they are and continuing to rise, I really feel like you're kind of at the cutting edge of what primary care is going to be going forward. So I'm terribly impressed with your business model. So how long have you been a physician, Dr. Eva?
Oh gosh, I've been a physician for a long time now. I graduated from medical school 19 years ago, and after that I did a 3-year residency in Denver, Colorado, and then came back to Texas to practice. And I've been practicing in the Rockwall, just kind of this general area of DFW, Rockwall, Rowlett, Mesquite. I've been practicing in this area for the past, I think that would be 17 years. Yeah, okay. 17 years. Mm-hmm.
And how long have you had Rockwall's Gym MD?
I've had this for the past 3 years. So I worked for a large healthcare organization before. I did that for a long time and became very disillusioned and decided to do this, and I love it.
Good for you. Good for you. That's awesome. So who is it we call it a target market, but for ease of explanation, is your ideal client?
Yeah. There's a lot of ideal clients for me, I think. So obviously, anyone who's uninsured would be an ideal client because this is a great option for uninsured patients, but also underinsured patients, patients who have insurance but have high deductibles and end up paying a lot of out-of-pocket fees every time they go to the doctor. That's another ideal client. Another ideal client would be somebody who just wants better quality care, because this is a concierge quality care, and it's a quality of care that you will not get in a traditional medical office.
Awesome. So tell me, what do you see as the single greatest impact that COVID's had on your practice?
Well, so I have switched to more telemedicine, just basically more reliance on telemedicine, but I was really just ideally positioned to do that because I was already using it quite a bit, and I already kind of had the systems set up that to enable that. And so it wasn't a hard transition for me. In fact, it was an easy transition. And I think that actually some of my patients are really liking it. And I think that even after the pandemic has passed, we're likely to use a lot more telemedicine now that, people are getting used to it. So I think that it's going to stick around and we're going to use more of it.
I think you're right. And I can tell you from personal experience, I've done it a couple of times myself since this started. And the initial time I was like, this is going to be weird. And it's not. Providers can be incredibly effective online, and with the technology we've got these days, I think you're absolutely right. I think this is, again, we were talking before this started about what's the new normal going to look like. I think this is going to be part of it, and so it's good for you for being on the forefront there. So, interesting question for you. So it's been said that smart people learn from their mistakes, but wise people learn from other people's mistakes.
Yeah.
What is a mistake you can think of that you can tell us about that might aid in other business owners out there that are trying to grow their business?
Well, a mistake out there for others who are trying to grow their business. I think that it's in this particular market, I think that the most important thing is to keep your overhead low. In a traditional doctor's office, there's a lot of costs associated with it. They rent incredibly expensive space. They buy very expensive equipment. But these things aren't necessary. So, I have really just simplified the way I do everything. Instead of locating myself in what would typically considered medical office space, I actually rented a little house right off the square in the historic area of Rockwall, which was significantly less expensive than the medical space. I mean, I could have, I would have been paying like 10 times as much for the medical space. So I think that you have to sort of break out of your paradigm of what you think a medical office is supposed to look like, and realize that it can look a lot different than what you thought it was, and you can actually save a lot of money that way. And
Good
then
advice.
pass the savings on to the patients.
Oh, awesome. That's great advice. Thank you for that. So second to last question, Dr. Eva. So I've got your email address, got your contact info, and I'll get all that included on this interview. Is there anything else you'd like people to know about you or your practice, or your offering, any offers that you have, or just anything in general you'd like the public to know?
Okay. Yeah. Well, so I am taking new patients during the COVID pandemic. I'm doing Facebook Live videos for people, trying to stay connected to people and get information out there. So definitely check that out. If you have kids, I love kids. I love patients of all ages. People want to like pigeonhole me sometimes into one particular type of patient, and it's really not the case. I see newborn babies, and I see older folks in their 90s. But one thing that I have available for uninsured patients is vaccines for children. So I know that if they go to a traditional clinic, they're going to be paying probably close to $1,000, or maybe like $800 for their pediatric vaccines. I do them here for $7 each. So at most of the well baby visits, that ends up being like $30 total.
That is awesome. That's a great offering, because I know the father of 3 girls, and the youngest right now is 16. Some of that stuff can add up in a hurry, especially when the kiddos are so tightly packed together.
Yeah.
So that's awesome to know. All right. So last question for you. Tell me one thing during the midst of all this pandemic, one thing that's been inspiring to you.
Well, I think that people coming together to help each other. I mean, that is always inspiring. I'm inspired by the medical workers on the front lines and all that they are doing. And I am also inspired by just regular folks out there doing things to help, whether it's making masks for medical professionals, or the Adopt a Senior program. I've seen a lot of people doing. So, I mean, I'm inspired by people's kindness and their giving.
Yeah, I agree with you. It's been really kind of cool for me to watch, especially from my perspective as a coach for small businesses. The business community as a whole is almost just started overnight acting like a big family and reaching out and supporting each other. And it's been really cool to watch. And the public at large has been the same way. It's, who would have guessed that 6 months ago we would like be able to come together this way, as polarizing as we were 6 months ago. So it's cool to watch. So great point. Dr. Eva, I really appreciate it. And I want to thank you personally as somebody that's neck deep in all of this, and a frontline provider. We appreciate you taking your own safety under duress and doing this for us. And I know my viewers are deeply express their gratitude towards you as well. So I thank you for coming on.
You're welcome. Thank you so much for having me. It's been a pleasure.